Good day, everybody. Welcome to Dr. Tom's Tips on Tuesdays at 10 in 10. First of all, really appreciate all the feedback and comments we've been getting from you, and keep them coming in. So today, the topic that we're going to cover is specifically how to maximize utilization of those Isolite mouthpieces in your practice. So good morning, Dr. Hirsch. How are you?
I am doing just fine. How are you, Rolando?
I'm well, thanks. So what tips can you share with our viewers with regard to maximizing utilization of the mouthpieces?
Can't take the call right now. I'm in a video conference.
No, that's cool. It's not like you're working or nothing, right?
No, not at all. Okay, so great question. How many conventions have we done? Hundreds and hundreds of dental conventions. And I get asked this question all the time at dental conventions. You know what? The mouthpieces are so damn expensive. How can I maximize the use of these mouthpieces? And that's just the best question. How do I get the most bang for my buck? Well, first of all, when I designed this mouthpiece, I made it bilaterally symmetrical. So if you're working on the right side, it's exactly the same shape as if you're working on the left-hand side. If you're working on the top, it's exactly the same for the right top and the left top. If you're working on the bottom, it's the same for the right bottom as the left bottom. One mouthpiece, all four quadrants. So planning is essential. Plan your cases. Make sure that you can get as much use out of a single mouthpiece as possible. For instance, I've got a filling or two in the upper left-hand quadrant, and I've got another little class 5 filling in the lower right-hand quadrant. I can do them both with the same mouthpiece. So that's the first thing. Planning is essential to any degree of success in dentistry. To any financial security, you've got to plan and maximize that appointment. Get as much out of that single appointment as you possibly can. Have a good plan going in. I know I'm going to start here, and I'm going to finish here, and I might even throw in here. Okay? So most bang for your buck, plan. One of my mentors once told me, you know what? If you want to bankrupt a dentist, have them do one single tooth at a time. They will go bankrupt. So that's the case. If you're going to work on one single tooth at a time, you're going to have a very difficult time financially. The Isolite was designed to allow you to do multiple teeth in multiple quadrants at the same visit. So here's tip number 2. Multiple teeth in multiple quadrants. That's how you maximize the cost of the mouthpiece. And that's how you maximize your efficiency. So first tip, plan. Second tip, multiple teeth in multiple quadrants. Okay.
Awesome.
That's good. That's a good start.
No, awesome. So there was a question about the different ranges of mouthpieces and picking the wrong size. What tips would you give for people who inadvertently pick the wrong size?
You know what? I've picked the wrong size. And even today, I've got 20 years of experience. Even today, I picked the wrong size. And, you can be flippant and you can throw it away and get another one. But you know what? That still goes to the cost of the bottom line. And sometimes you pick the wrong side, you bite the bullet and you'll live with it. So how do I live with picking the wrong size? Well, let's say I picked one that's too small. I put this in the mouth and I look, oh man, I could have used one with a deep vestibule. Okay, you know what? I have a cheap 2-cent fix for that. I'm going to take a cotton roll and I'm going to shove a cotton roll down in the lingual vestibule under the tongue. It's not going to be as perfect as having something that goes deep down into the floor of the mouth, but there's literally a workaround for almost everything. So if you pick the wrong size, if you pick one that's too small, you can augment it. You can roll up gauze squares and put gauze squares down there. You can put cotton rolls down there.
You can still use it.
You still use the damn thing. Heck yeah. Heck yeah. Don't throw the baby out with the bathwater here. Use it. You've got this thing. You've opened up the package, and sometimes it's just you've got this thing all hooked up, and it's in the mouth, and you look at this thing, and oh God, should I get another one or not? You know what? Sometimes it's just not worth the hassle of getting another one out of the bag and opening it up and hooking it up and putting it in. Nah, just use the damn thing. Live with it. You know what? You'll learn from choosing the wrong size. You'll learn what to do in the next situation. You know what? Nothing wrong picking the wrong one. It's a learning experience. That's what this is all about. You learn. You know, you weren't as fast the first time you did an occlusal filling on number 30 in dental school. You learn. You learn how deep to go. You learn how fast and how quick. You got to learn. There's a learning curve and anything.
Awesome. And then you designed to the two new mouthpieces, I think the extra small and the pediatric, different from the other mouthpieces.
Yeah.
What are kind of,
kids, thank you. Kids have a tendency to really clamp down hard, and so do a lot of geriatric people. They really have a tendency to squeeze the dickens out of these things. So a lot of our pediatric dentists wanted us to design a stiffer bite block. So with the extra small and the pediatric ones, I made a stiffer bite block. It's actually about 40% stiffer than a regular bite block, so it's much more difficult to crush. So on these patients that have a tendency to close and to clamp down, you can use those extra small mouthpieces. Fine, they may be insufficient to really vacuum up the water as efficiently as necessary if they're shallow in the floor of the mouth, but that doesn't mean you can't stick a saliva ejector down there too at the same time. Sometimes you got to do what you got to do. If you still see water pooling down there when you picked out the wrong size, you put it in the mouth, there's a gap down there, the tongue is still protected, but you can see the tongue can still get underneath there. You don't want that to happen. Plug that up with a couple of cotton rolls. And now you see it's not vacuuming as well as it would if you had a bigger mouthpiece. Take a saliva ejector, stick a saliva ejector in their mouth. I mean, your assistant's got two hands, so you can do X and Y and Z at the same time. She can do a whole lot more than that at the same time. She's really good.
Awesome.
On the other end of the spectrum, as we've talked about before, what happens if you pick out one the mouthpiece is too big? Trim it. You got a little gaggy area where it's touching the palate, cut it back. Be proactive, be smart. You got a lot of great education. You're at the top of the brain scale. Most dentists are. People like me now, we're kind of the lower end of the scale, but you guys, you're all the top of the food chain right there. So you guys are good. You're smart. Use your noodle, make it work.
Awesome. And then you mentioned before, and I think this is an important tip. And once a patient has had it in their mouth, then if you inadvertently pick even a bigger one, they relax or they can use it, right?
People usually adapt to what you're working with. Some people will, some people, what was he? SW, some will, some won't, so what?
SW.
Some will adapt, some won't adapt, so what? You know what? You're doing the best you can for the majority of the people. Most of the time people will adapt. Sometimes people won't, but they will tolerate through it. You just got to go. I don't mean to be flippant,
No.
But sometimes, this is not the ideal working situation for people. People don't want to be in the office anyway. They don't want dentistry done. They kind of hate what we do and they can't wait to get out. So they'll really kind of tolerate anything to help them get out of the chair better. So, sometimes it's not the best scenario, but it works. And our job is to get things like, God, I had a patient yesterday. In fact, just before we went on the air, his wife came in. Now, this is a patient. He's a little older. He has Alzheimer's. He's starting to get a lot of cervical decay. And I literally had to jam a medium mouthpiece in there. I was doing 14 and 15, a DO on 14, an MO on 15, way far down on the roots of his teeth. I couldn't get a rubber dam on there to save my life. It was subgingival. I didn't want to do crowns. I worked my rear end off on this guy yesterday. And you know what? He left the office mad. He did. He came in, his wife just came in to talk to me just before this conversation. He said, God, Michael was mad yesterday. He says, nobody ever explained anything to him. Well, yeah, we did. And yes, he forgot. And so I just had to explain this to her. So not everybody likes what we do. This guy's been my patient for 30 or 40 years, and he just didn't remember what was happening. So, sometimes
you deal with
not happy, but that's okay. I got the job done.
So the tips today, you can use different sizes because they still work. You can augment with cotton rolls, a saliva ejector, that type of thing. Patients will tolerate it.
Yep.
Small and the extra small and the medium
Yep.
have a stiffer bite block, so you can also use that not just on kids but also on geriatric patients.
Yep.
And then finally, some will, some won't. So what? Do the best you can with
Yep.
what you have, and don't feel that you can't get through it.
And multiple quadrants, multiple restorations. I mean, that's key. You know, do 2, not 1. Do 3, not 2. Do 6, not 1. I mean,
Awesome.
You know, they're there. You got the anesthetic. You got the time. You've got the materials out there. You got a drop of bonding agents, a couple $3. So yeah, maximize this stuff.
Awesome. Hey, so next week is, I think, isn't it Thanksgiving week? Maybe Dr. Tom's tips will be on how to make your famous tapioca and cook a turkey. So,
let me tell you know, I'm next week. I promise you, next week I'm going to tell you my secret ingredient to the turkey stuffing.
awesome.
I have got the secret ingredient. You'll use this. It'll blow you away. It will blow you away. It's so good. Okay. So anyway, everybody, see you next Tuesday.
Thank you so much, Dr. Hirsch. If you like this, please share it. If you have questions, please ask us. Dr. Hirsch is willing to and always happy to share any information with you. Have a great week. Have a safe week. And it's always a pleasure. Thank you so much, sir.
Okay, bye, everybody. See you next Tuesday at 10.